confirming and supporting the medical decision making and all of the extra work that we do as pediatricians that sometimes we don't document.
Welcome everyone to the Office Practicum PediaTricks Podcast. That's Pediatrics with a K. I'm Sean Rossler, Senior Instructional Designer on OP's Instructional Design Team and the host of the PediaTricks Podcast. And our mission on the show is to make your lives easier. No, we won't be able to help you make sure the kids reapply sunscreen every couple of hours, but we do hope you'll leave this podcast learning something new. Now, we've already heard about AI, specifically Opie AI here at OP. But that was, if I may, an overview. Overall functionality and so on, it definitely gave us an understanding for all to absorb. But what if we look a little bit deeper? There's definitely a specific audience who will be, admittedly, leveraging this more often than not, and that's our clinicians. As such, I wanted to take a deeper look at Opie AI through the lens of clinicians. What benefits, what concerns, what considerations, all of it. But of course, if you've been paying attention, I'm never the guy that has the answers, and last I checked, certainly not a clinician. But here at OP, I know not one but two who have been very busy, focusing on everything a busy clinician needs to know about Opie AI. Joining us on today's podcast are Doctors Dan Fighton, Chief Medical Officer here at OP, and Rich Szabo, Cross-Functional Physician Liaison here as well, to talk about Opie AI through the clinician lens. Just what does Opie AI, as well as AI scribes in general, mean to clinicians? Why should clinicians and providers use this innovative technology? And how does using Opie AI actually give you patient time back? Let's find out. Dr. Fighton, Dr. Szabo, welcome back to the show.
Thank you, Sean.
Thanks, Sean.
Absolutely. Always a pleasure to have not one, but two phenomenal human beings here. And again, return visitors. I get it. You've been here before. But for the folks who maybe did not catch it the first time, folks who don't know you digitally here, tell us just who you are, where you come from, and what it is you do.
Sure. I am Chief Medical Officer at OP, as you said. I'm an OP user and a co-founder of Greenwood Pediatrics, a 25 clinician, 3-office practice in Denver, Colorado. We started it almost 30 years ago now, and it has certainly flourished. But I've also been interested in technology, and I'm the founder of Remedy Connect, which provides patient engagement services, websites, and digital tools for marketing for pediatric practices. And now I'm excited that we're going to be able to leverage the AI in a safe and secure and accurate way.
Excellent. How about you, Dr. Szabo?
So I was a pediatrician practicing for 20 years until I stepped away in 2018. I joined Office Practicum in 2020, and in my role here, it's interesting because I get to work across the whole company. So I'm involved with product team, our clinician team, sales and training. So I get to impact, I hope, a fair amount of different ways that people are using Office Practicum.
That's awesome.
And I'm also very excited about AI and technology and how it's going to just improve the lives of practicing providers.
For sure. And it really seems to be all the talk lately. Opie AI, really AI scribes in general, to me, in the layperson seat, it sounds revolutionary, but maybe there again, that's because I'm both a tech fan and close to it. Looking at it through the lens of providers, albeit providers related to tech, looking at it from your perspective, what do AI scribes mean to clinicians in the care landscape?
So I think that technology in general, there's different perspectives from providers. People are excited about technology. People are scared of technology. People may be hesitant or want to jump right in. But I think in general, an AI scribe, it may sound odd, but I think it actually relaxes the provider. So it frees you up. You're not tethered to an EHR screen. You're not tethered to a keyboard, to typing. You're able to interact more. And I think that that's important because every pediatric visit is different. There are nuances to every conversation with every family. And so I think being able to focus on the family allows you to bring back that art of medicine that sometimes kind of gets left in the background due to things like technology.
Yeah, I mean, that makes a lot of sense to me. Dr. Fighton?
I think that pediatrics is primarily an experiential profession. We are needed to have those relationships with our patients, and what we've seen more recently is that due to the increased cost of healthcare and the decrease in payments, the pediatric visits are moving from an experiential visit to a transactional visit. Put your dollar in and your soda will come out. That doesn't work very well in pediatrics, and certainly not in mental health nor in adolescence. And so AI helps to augment that experiential capability.
I love that. I love that. You know, as a father myself, as a father of a child with a disability and a cognitive one at that, you know, that's good to hear, because, you know, I've been there, I've seen it, and I think to myself, you know, having that time back, that's got to feel amazing. I would imagine one benefit, obviously, to using Opie AI is that the clinicians can get FaceTime back with the patient, right? Because there's little to no typing during the visit. Can you confirm or deny that, and really what that FaceTime back means when we eliminate that I've heard it called busy work?
Mm-hmm. So let's talk about the studies so far. The current studies in AI Scribe do not include specific studies about pediatrics. There are some primary care studies, and within that subset are some pediatricians, but they're mostly family practice. And so we have to keep that in mind. Right now, most studies have shown one common result, and that is a significant reduction in pajama time. Mm-hmm. The largest study, which came from Kaiser and recently was published, they looked at 2.5 million notes, 2.5 million encounters that were delivered with AI Scribe. And what they found was almost a 2 minutes worth of saving for pajama time. So 2 minutes per appointment for pajama time. Mm-hmm. You're doing 20 visits a day or longer. That's going to get you home without having to do a lot of typing at nighttime. The other studies have all agreed in the concept of pajama time. The exact amount of time that it saves per visit varies, and I think that depends on the specialty and so forth. So we're looking forward to down the road being able to do some studies and really show the significant benefit in time savings for pediatricians.
Absolutely. Dr. Zeba?
Yeah, I think that I would totally confirm about getting FaceTime back. It's so important because, especially in primary care medicine, it's all about relationships. And I would argue even more so in pediatrics. So you're building trust from birth or before birth with prenatal visits all the way through adolescence. You're with that family through all of their childhood. And so you're not focused on a chart. You're not focused on a screen. You are listening. You are engaged. You're making eye contact. Families notice that. They appreciate that. And I think that allows you to get to a deeper level or deeper detail in your communication, and then by default, a deeper level, more comprehensive in the notes that are generated. I think this is doubly important in complicated or comprehensive encounters or visits.
Yeah, it's to me, again, sitting outside the clinician ring, it's almost a little ironic that we're rehumanizing medicine through technology. That's kind of what it sounds like to me. And you know, to the point of pajama time and saving that time, you know, I remember you know arguing back and forth about one click, but one click done 100 times, it adds up. And so, you know, to your point, Dr. Dan, that 2 minutes per, you're in 20 appointments a day, it certainly adds up. And, you know, ultimately time is valuable. Time is money, whatever adage you want to use. And it's my understanding that clinically, Opie AI provides just that back to busy clinicians, time to focus on other aspects of care, as you've mentioned. How valuable is that to clinicians? And with Opie AI continuing to learn, that's a whole other can of worms to unpack. Does it only get better as it's used more?
I would say immensely. I think it's immensely valuable. It's to the pajama time point. You're freeing up the physician after hours. You're allowing them to go back to their families, to their communities, to activities, to hobbies, to whatever. Yeah. So it addresses what is a very real problem in medicine, and that's burnout.
Yeah.
So to that point, it's a win all around for busy clinicians. And Opie AI will be learning your individual styles. You'll be able to kind of train it to how you like to document, which is also a time saver, in addition to the fact that the AI-generated note may actually add things in that you talked about but wouldn't necessarily have thought to include in documentation. So it's going to make documentation more detailed and more comprehensive as well.
Mm-hmm. Mm-hmm. Dr. Dan?
One of the things that I've found with our work with Remedy Connect is the degree of customization that clinicians prefer. Mm-hmm. Everybody wants their technology to work the way they want it to. And that presents problems in technology. But with Opie AI, there is a high degree of customization. Mm-hmm. I've been really excited, both Rich and I have been excited about the use of dot phrases. And dot phrases in Opie AI allow us to create certain bits of a physical exam. If you want a more significant or more complete neuro exam, if you want a more complete mental health survey, etc., all of that can be added into Opie AI. Mm-hmm. And down the road, coming next year, people will be able to share their templates and their best dot phrases. So this is only going to get better and better.
Incredible. Dr. Szabo?
I just agree. I've been so impressed with Opie AI in its evolution over the past 2 months or so, in that we do train it. It learns and it evolves, and it's just become a tool that is, it remains pediatric focused, and it really just allows the provider, it frees them up, like I've said before. It just allows them to be themselves in the room, to talk the way they want to, and then it learns to document the way that they want to.
Just incredible. And again, I'm in it. I've been in healthcare IT for more than 20 years, and I find this just simply incredible. So, Dr. Fite and Dr. Szabo, anything else you'd like our listeners to know about Opie AI before we wrap up?
I think what we continue to hear from users is how Opie AI captures the sideline comments. I was seeing a patient over the weekend, fourth grade female, who was being seen for a relatively harsh cough. And she mentioned that she had some upper abdominal pain that was actually right mediastinal and costal tenderness. It was related to her recurrent cough and essentially costochondritis. Now, typically, I probably would not have added that to the note. It was just sort of a sideline comment. I felt the location and commented on it, but it gave me that as an additional diagnosis and a plan for what to do in terms of how to treat it. Many people have said, who are using Opie AI, that it's picking up other diagnoses. It is confirming and supporting the medical decision-making and all of the extra work that we do as pediatricians that sometimes we don't document.
Wow. So again, humanizing it and kind of acting as a net to catch things like we might not pick up. Dr. Szabo?
Yes.
I would also stress that really, this is just the beginning. The Opie AI Scribe is fantastic. It's just the beginning. It is going to continue to evolve, not just in its scribe capabilities, but we will be adding more and more pediatric content. So pediatric clinical practice guidelines, some certain decision-making prompts to assist. In addition, thinking about ways to utilize AI in administrative roles to help streamline and make your office more efficient, not just from the scribe and dictation and note generation, but also to impact other areas. So I think we're off to a fantastic start, and the best is yet to come.
We've only just begun, as the song goes. So, Dr. Szabo, Dr. Feighton, thank you so much for taking time out of what I know are busy days to be here with us on the podcast.
Thank you very much for having us.
Of course. And we hope you've enjoyed this episode of the Office Practicum Pediatrics Podcast, or OP3. Be sure to watch for updates and other announcements via both our OP community listserv, as well as our social media outlets. And if you, yes you, have an idea for a guest or would like to be a guest yourself, reach out to the show. We'd love to hear from you. Be well, stay safe, and remember, we can always learn new tricks.